These are in listen-only mode.
Hello, this is Julie Willems-Van Dyke from the County Health Rankings and Roadmaps program in Madison, Wisconsin, and I welcome you all to our webinar this afternoon where we will explore the 2015 RWJF Culture of Health Prize and provide you hopefully with all the information you need to make a decision about whether you and your community are ready to apply for the prize and provide you all the information to proceed with that application. With me today, coming to us from Princeton, New Jersey, is my colleague Abby Kofsky, Senior Program Officer at the Robert Wood Johnson. Good afternoon, Abby.
Good afternoon, Julie.
We are so happy to have hundreds of people across the nation with us today, and I know many of you, this may be your first experience on GoToWebinar, and so I want to just give you a quick introduction to the technology here. On your computer screen, you should be seeing the slides. You're actually looking at my computer screen here in Madison. So that's your viewer window. Over on the right-hand side of your screen, you will see what we call our control panel. And what is especially important about this control panel is you'll also see a box that says question log. And that is where you will pose questions to us. Because we have several hundred people on the webinar with us today, it would be impossible to handle questions via the phone line. And so we encourage you, as you listen to Abby and I throughout the webinar today, to type in any questions that you have, and we will be reserving the second half of our hour and a half together today to respond to those questions. It really is our goal that we get to as many questions as possible, hopefully 100% of the questions, and so therefore as I said, we'll have plenty of time at the end. But again, you can type in a question in that question box at any time, and including if you're having any technical difficulties, feel free to type questions in there. I have two colleagues who are assisting us today who you won't be hearing from, Kirsten Siemering and Carrie Carroll, both important staff who work on the RWJF Culture of Health Prize with us here, and they will be looking at your questions, responding if there are any technical issues, and teeing up those questions for Abby and I as we go through the webinar today. So just really quickly before we get into the meat of it, I want to give you a little bit of background on the webinar because I know it'll help people as we begin to move forward. So there's 3 phases of application for the RWJF Culture of Health Prize. Phase 1 is open to all U.S. communities, and that is the phase we'll be spending the most time discussing today. Then from phase 1, we narrow the field to selected communities, generally about 50 communities that will be selected to move on to phase 2. And then finally, from that group of 50 communities, we will select up to 16 finalists who will enter the site visit stage. So the phase 1 deadline is Wednesday, September 17th, 2014, and at 3 p.m. Eastern Time. I encourage you all to put that date and time on your calendar right now, because that is a date cast in stone. There are no exceptions to that deadline date, and so we encourage you to make sure you have that well in hand. And then just to give you a bit of sense of what happens beyond September 17th, here's a quick review of the timeline and key dates. Phase 1, as I said, due October 17th. About a month later, we'll invite people to move on to phase 2, and those applications will then be due on December 10th. In mid-February, we will be ready to invite communities to the finalist phase, the site visit phase, which will happen between April and June of 2015. And then the announcement of the 2015 RWJF Culture of Health Prize winners will happen in the fall of 2015. So here's what we're going to do for the rest of our time together this afternoon. First, I will turn it over to Abby, who will provide us with a bit of background about the Robert Wood Johnson Foundation's vision and investment in a culture of health. We'll then provide a bit of an overview of the County Health Rankings and Roadmaps, which is the foundational program for the Culture of Health Prize. Then we will move into a bit of discussion about the prize purpose and introduce you to our past and current winners. And then we'll spend some time going into the nitty-gritty of the prize application and selection process. And as I said, reserve about the last 30 to 45 minutes of our 90 minutes here together for questions and answers. So you'll be hearing both my voice, again, Julie Willems-Van Dyke, and my colleague Abby Kofsky's voice. So let me turn it over to Abby.
Thank you, Julie, and my welcome to everybody that is joining us this afternoon. You know, I imagine many of you are aware of the call for applications and are joining us today because you're familiar with the Robert Wood Johnson Foundation and you know us as the nation's largest funder that is focused explicitly on health and health care. And I imagine some of you might know the foundation because you listen to NPR and you hear our tagline there. But what I really want to encourage all of you, for those of you that know the Robert Wood Johnson Foundation and those of you that don't, is to think of us as a partner, to think of us as a leader and a collaborator in working with communities, working with national leaders in building a culture of health in our nation. And as you can see on this slide, this really encapsulates, you know, our vision that we as a nation will strive together to create a culture of health that enables all of us in our diverse society to lead healthy lives now and for generations to come. That is really, you know, what we aspire to. And when we talk about building a culture of health, it is really building a culture where promoting health is as important as treating disease. And we also know that that is not something that we can do alone. And for that reason, this is work that we do very much in collaboration with leaders like Julie and our partners at the University of Wisconsin Population Health Institute, but also with leaders and communities across the nation. We really feel that we are at an inflection point in our nation where the conversation around health is changing. And we think it's a very rare moment, and you can appreciate the quote on this slide. It's a rare moment when you can recognize the beginning of great change because you're in it. And it's oftentimes hard to step back and to really appreciate the change. But we believe that in our communities and across our nation, we are at this point of great change. And as it says here, that change is carried and cultivated by everyday people, by leaders who are really transforming our communities to be healthy places, places where health flourishes. And we see our job at the Robert Wood Johnson Foundation as being to find those early and strong examples of communities and leaders that are creating a culture of health, to be able to learn those lessons of how those communities are creating such a culture, and then to be able to share those lessons and to be able to link together those leaders. So as communities, we can join forces and really translate the small victories that we see in our communities and our day-to-day lives into a national movement. Because that is, again, what we aspire to in creating change in our nation, change that allows all of us to lead longer, healthier lives. So for us, the RWJF Culture of Health Prize is the opportunity to do that, is the opportunity to identify and to elevate communities that are really at the forefront of health, at the forefront of prevention, and at the forefront of creating this opportunity for good health for all. So I know that we'll have the opportunity to talk in more depth about, again, the purpose of the RWJF Culture of Health Prize and the attributes and the criteria of the prize. But I lay this out as the prize winners that are already a part of the Robert Wood Johnson Foundation and the County Health Rankings and Roadmaps family really are leading the way. And we see this opportunity as one that will allow us to really grow that movement of leaders as we think about this work moving forward and all of the great opportunity we have to improve health in our country. So with that, what we would like to do now is just provide a little bit of context for the Culture of Health Prize. Again, you see how closely it aligns with the Robert Wood Johnson Foundation vision and mission to build a culture of health in our nation. But it draws very heavily on the work that we at the Foundation have done in collaboration with the University of Wisconsin Population Health Institute, starting with the county health rankings. And I want to turn it back to Julie to be able to provide a little bit of that context and how the prize grew out of that effort.
Great. Thank you, Abby. I suspect many of you on the webinar today are familiar with the County Health Rankings, and probably many of you have visited our website here at countyhealthrankings.org. If you have not, I encourage you either now or after the webinar to take a peek at countyhealthrankings.org. It is on the foundation of this program that the RWJF Culture of Health Prize sits. And one of the foundational pieces of County Health Rankings and Roadmaps, and really how we're thinking of building this culture of health throughout our nation, is this picture of health. And it underpins everything we do. It certainly guides the way we collect and collate data to produce the county health rankings, but even more importantly than that, it helps us really frame up what we think about health and how we can take action around health in our community. So when we say Culture of Health Prize and we define health, I would constantly encourage you to print this model, place it on your bulletin board in your office, bring it to your meeting with partners across the community, because this is the model of health that we're talking about when we talk about this health prize. So ultimately, what we're striving to do is what you see in the green boxes at the top of the model. Ultimately, we're all striving to increase length of life for the people of our community, but equally important, improve quality of life for them. So as Abby said, it's not merely the absence of disease, but it's really about a holistic sense of well-being in your community. In order to achieve those health outcomes, length of life and quality of life, we know that there are many health factors that drive how long we live and how well we live. And so when you think about health in your community as it relates to the Culture of Health Prize, think about what are we doing in our community to improve health behaviors, to make the healthy choice the easy choice. What are we doing in our community to improve access to clinical care and the quality of care that people receive in our hospitals, in our healthcare settings throughout our community? What are we doing in our community to support social and economic factors, to support good educational outcomes, to support the establishment of businesses and employers who provide living wage jobs in our community? How are we helping people feel strongly connected to each other? And how are we creating a community where people feel safe? And then finally, health is also about our physical environment: clean air, clean water, quality housing, transit options that support good health. And so when we think about health as part of the Culture of Health Prize, as part of the County Health Rankings, as part of this movement that Abby describes, it's this very broad and holistic view towards health. Now, in order to achieve quality health factors that lead to good health outcomes, we need to focus on policies and programs in our community. So the Culture of Health Prize really hones in on what are the accomplishments you've had in your community, what type of policies and programs have you collectively put in place to drive those health factors and those health outcomes. The whole point of the county health rankings in the first place was to raise awareness about those many factors of health, to provide communities with an annual checkup of their community's health, to help many people, not just doctors and nurses and public health practitioners, but all of the people you see in the middle of this take action cycle understand that we must all work together to improve health, because no one sector can do this on their own. So another foundation of the RWJF Culture of Health Prize lies on this take action model, that it's about working across all of these sectors in your community, and very importantly with community members themselves from all sectors of life, from those who are most challenged by health challenges to those who find achieving health easy in your community. So really working together across all of those sectors to continuously implement the action cycle that you see around the outside. Knowing what's important in your community, and then taking action to improve it and evaluating your actions along the way. At the County Health Rankings and Roadmaps website, you will find our Roadmaps to Health Action Center that complements the data from the County Health Rankings. The Action Center helps you with tools and guidance around how to implement this cycle. And so I encourage you to take a look. If you're on that journey towards health in your community, or you want to be, there's a whole variety of tools and resources there available for you. And then not only the data and the Action Center, but much more on the County Health Rankings and Roadmaps website. Tools, we hold regular webinars, there's stories of other communities doing this work. You can download the County Health Rankings data, and so a wide variety of resources available to you to both understand the health of your community and then understand how to move action forward. So the RWJF Culture of Health Prize is really about shining a light on communities that are doing this work incredibly well. Because we know, even back in 2010 when we first released the County Health Rankings with our colleagues at the Robert Wood Johnson Foundation, that that was not the start of people taking action to improve health in their community, that there were many places across the nation that were already doing this good work. So the prize was an opportunity for us to stop and issue this call for applications to find some of those great places in the nation. And while I'm going to turn it back to Abby to talk a little bit more about the purpose and introduce you to our past winners, we know there are more winners out there. And I know earlier when I was telling you about the process, I got you all the way to the point of identifying the up to 16 finalists who would move forward, and someone posed a question about how many people will actually win the prize. And so in 2015, we are going to award up to 10 RWJF Culture of Health prizes of $25,000 each to communities. So in the past, you'll notice we've given 6 prizes, but because we are so excited about the level and quality of work that's happening throughout the nation, we're expanding the number of prizes we will give in 2015 up to 10. So let me turn it back to Abby and have her talk with you a little bit more about the purpose of the prize and introduce you to some of our past prize winners.
Sure. Thank you, Julie. Well, I think, you really alluded to what is the sort of fundamental purpose of the prize, Julie, and that is honoring, elevating those efforts that are already happening in communities to improve health, that are broadening the conversation around health, and are engaging many, many stakeholders. So that really is a big part of what this is all about. One of the things that you won't see on here explicitly is that this is a $25,000 prize. And, that is the dollar amount that goes to our prize winners. But what I would say and really differentiate this here from other programs is this is not a grant. When you submit your application, we're not asking for a budget. We're not asking what you're going to do with those dollars to make change. That the purpose of the prize is really to talk about what you and your community have already accomplished on your journey to better health. And for us, you know, the winners from our prize-winning communities, they really become ambassadors for the nation. They become leaders who can share the successes, share the challenges, share the opportunities that exist in communities to create healthier environments. Again, we really believe that there's an enormous amount of change that can happen in our towns, in our cities, in our counties, in our regions to create better health. And the opportunity to elevate those leaders and community members who are doing that work on the ground is a really powerful way that we can change the national dialogue and conversation. So for us, it is finding that innovation, finding that leadership, and elevating it, and giving really you a platform to share and tell your work. So that is very much sort of at the core for us about what the purpose of the prize is. That I will say, you know, as we look at who our existing prize winners are, you know, one of the things that they will share about the prize is that it really validates their work. It validates their work in front of their community with their leaders across many, many organizations. All of you know that this type of work in communities takes a lot of effort. It takes time. It takes buy-in. And so the prize really becomes a way to recognize and honor all of the commitments that your various partners are making, and really being a springboard for work to move forward. So as you can see here on this slide, we have our 2013 prize winners. They are highlighted in purple. And you can see starting up on the right side here in Massachusetts, we had Fall River in Cambridge, Massachusetts. Also in 2013, Manistee, Michigan, Minneapolis, Minnesota, New Orleans, and Santa Cruz County in California. Our 2014 winners that we just announced last month, starting on the West Coast, we have Spokane County, Washington, Taos Pueblo, New Mexico, Brownsville, Texas, Williamson, West Virginia, Durham County, and Buncombe County, North Carolina, 2 counties in North Carolina. So again, you can see here a wide range of different types of communities in different parts of the country that are approaching their work to better health, all in different ways. And that is, you know, another opportunity and another important element of the prize, that it recognizes the unique journeys of these communities as they work to improve health. And here, this is actually one of our favorite shots of a couple representatives from each of this year's 2014 prize-winning communities. This year we announced the winners at the Aspen Ideas Festival, the Spotlight Health. And again, that is just an example of how we try to use the announcement of the prize winners and sharing their stories and putting it in front of new audiences. So this year, we had the opportunity to make that announcement at the Aspen Ideas Festival Spotlight Health. And as you can see here, there was no shortage of photograph scenery for the event. And again, just a wonderful, dynamic group of leaders who, if they saw this picture, the first thing that they would tell you is that there are many, many other people in their communities that are also doing this work, and they are just among the representatives that were there for that part of the conversation. So what we want to do now is go a little bit deeper into the very specifics of the prize application and selection process. And to do that, I'm going to turn it back over to Julie. And I'm sure Julie will be on just a second here.
Julie will be on as soon as she unmutes her mute button. Can you hear me now, Abby?
You're just fine.
Okay, great. Thanks. So the first thing I want to direct everybody to is our call for applications. And you can download this at countyhealthrankings.org/roadmaps/prize. If you go to the rankings website, you'll see 2 tabs up in the upper left-hand corner. One says rankings, one says roadmaps. Click on that roadmaps tab, and you'll also then see a place you can connect with the prize portion of our website. So here is the 2015 RWJF Culture of Health Prize. All of the content that we'll be reviewing today is contained in this document, but once again, it's very important for you to it's very important for you to review this information yourself, and as well as on this website, and also where we will direct you to apply, there are a series of frequently asked questions. And I strongly encourage you to read through all of the frequently asked questions as well, and that will give you a very complete picture of everything that you need to know in order to apply for the prize. Those FAQs have primarily come from people from the last 2 years, and so they're real-life questions that real-life community members have found to be helpful. So one of the most important questions is who is eligible to apply. We want to emphasize that this is a place-based prize. This is not a prize for a particular organization. This is not a prize for one particular accomplishment in your community. It is a prize that reflects the work of a geographic place. So who is eligible to apply? Towns, cities, counties, tribes and tribal communities, or regions. And regions are contiguous towns, cities, or counties. So let's say, for example, you come from an area served by a tri-county health department, and your 3 counties can apply together for the prize. So we don't define a region for you, but we do ask that it be a series of contiguous towns, cities, and counties. As I mentioned, we honor the work of whole U.S. communities, so submissions that represent the work of a single organization or initiative will not be considered. So this is a very important consideration, and once again, just want to emphasize it's the work across your community. Now, we'll be talking a little bit later about the applicant process. We certainly know that someone has to take the lead on actually pulling this together and submitting the application, and we'll talk a little bit about how that process works. But basically, it can be any organization or coalition from your community. And I know we had a question earlier about coalitions, and coalitions do not have to be formal 501c3 coalitions. We have had coalitions apply in the past that are loosely linked groups of people that have been working together and have been able to demonstrate accomplishments and progress. So that is fine if such a coalition chooses to be the lead applicant for the prize. So the most important thing as you proceed to prepare your application and think through the application process is thinking about the 6 prize criteria. And for those of you who may have already downloaded the call for applications, you will find these prize criteria on pages 5 and 6. So what Abby and I are going to do is go back and forth on the prize criteria and explain each of them to you, because this is the heart and the soul of what needs to be present in order for you to move from a prize applicant to a prize winner. So the first criterion is that we are seeking communities with the capacity for and dedication to create lasting change, and the first criteria is that you define health in the broadest possible terms. I think we already have seen that, and in this picture, because you notice this is not a picture that's taken in a doctor's office, that's taken in a healthcare setting, but it's in a preschool, an early childhood learning center. And so it's a representation that we know that how we educate our youngest citizens is part of how you define health in the broadest terms in your community. I would point you back again, and you'll notice the model is included on page 7 in the call for applications. But as I mentioned before when I introduced this picture of health to you, this is the broadest possible terms that we're speaking of. We're interested in hearing about your work across all of these sectors. And as you'll note in the prize call for application, we are particularly interested in assuring that you address those social and economic factors. As you can see, they contribute 40% towards health outcomes. And frankly, they are an area that people don't always typically think of when it comes to health. And so it's really important that as you think about your application, you think across all of these important areas of health factors. So I'll turn to Abby for the second criterion.
Sure. So here you see that we are seeking communities with the capacity for and the dedication to creating lasting change. And that means that we are looking for communities that have really made a commitment towards sustainable systems changes and policy-oriented long-term solutions. And let me tell you a little bit about what we're looking for with this criteria. We know that there is not one single way to improve health in your community. And what we are looking for is how you are really identifying and outlining a strategic approach to improving health and to addressing the biggest barriers to health in your community. We know sometimes that will take the form of a program. Sometimes it will take the form of a policy or a systems and environmental change, and we just want to understand and see that there really is a thoughtful and strategic approach to how you are implementing those solutions. And I would say, you know, while we know that programmatic solutions, service-oriented solutions are often a very important piece of the puzzle, we want to understand how these solutions become sustainable. And oftentimes that does mean changing systems, changing policies, changing the physical environment. So we're looking for how you are using that whole suite of approaches in thinking about sustainable change. When we look at how you are, you know, implementing those sustainable changes, you know, I do want to point out that we recognize both, you know, the value of evidence and that programs and policies and approaches are drawing from the very best evidence available. But we also really recognize the value and the promise of innovation, and that sometimes we need to act before we know where the science or where the evidence is going to fall on something. And so, you know, we value both. And we're looking for, you know, how communities are thinking about and balancing both where there is evidence and where they're really trying to harness innovation. And in cases of the latter, it is recognizing that as we innovate, as we try new things, there is a commitment to then build the evidence base for those approaches. So that is, you know, at the heart of this criteria, and really trying to step back and understand how throughout the community are you making decisions, you know, with that goal of improving health in mind. So that is, you know, all of the attributes of what we are trying to get to with prize criteria number 2.
Prize criteria number 3 is focusing on cultivating a shared and deeply held belief in the importance of equal opportunity for health. And we recognize that there are many people in your community for which health is a reach, where there are gaps in opportunities that disproportionately and negatively affect certain populations. Oftentimes when we think about those gaps and those disparities, we think about ethnic minorities. And while we really encourage you to think about those populations, we also encourage you to think about people with limited English skills, with lesser incomes, with limited education, who may also be disproportionately be affected by poor health factors in your community. We also recognize in this criteria that this is about collective problem solving that values all of the voices and perspectives within your community. So prize-winning communities really have the members of their community, and particularly members of populations that are most affected by poor health, as an integral part of both identifying need and creating solutions to those health challenges in their community. So we really want to see how your community is putting health within everyone's reach in the community. And I have to tell you a little story about this picture. This picture, I'm pretty sure, is from Williamson, West Virginia, one of our prize winners. And this is a community garden. What you don't see just out of the range of this picture is this community garden is located right across the street from a housing complex for elderly and disabled people. In fact, you can see behind the girl on the right someone in a wheelchair gardening in that raised bed there. And so this community garden is not only a great community garden, but it was built very much with a focus on this criteria, that they wanted that garden to be equally accessible to everyone in their community, including those who are older and those who have disabilities. So I love this picture as a great illustration of that criterion. Back to Abby.
Okay, so here we have prize criteria number 4, and this is really focused on leadership and the fact that we are seeking communities with the capacity for and dedicated to creating lasting change by harnessing the collective power of leaders, of partners, and community members. And here we see some of the leaders and partners that came together in Manistee, Michigan. This really goes back to a point that Julie made earlier about this being a place-based prize. While we know that there are individuals and individual organizations that are out there doing great work that deserve and should be recognized, what makes this prize unique is that what we are looking for is how partners and leaders across the community are coming together to leverage their collective assets and their collective power for change. And we know that we can't move the needle on health improvement if we rely, solely on those working in healthcare, working in public health, but it requires leadership from business, requires leadership from our schools and education systems, from our elected officials, and also from community members themselves. And so we are especially interested in how communities are bringing together all of these leaders, how they are creating the opportunities for buy-in, decision-making, and really coordinating and aligning efforts within a community, and how the community is really there as part of the decision-making framework. And so it's not just engaging a community or engaging this group, but there really are true partnerships about how decisions are being made and change is happening throughout a community. So with that, I'll turn it back to Julie.
Great. So prize criterion number 5 is about securing and making the most of available resources. And what I really want you to take away from this criteria is it is not necessarily about your community being the best grant writers in the world. While that's certainly one way to secure and make the most of available resources, we're looking for communities that have a true enterprising spirit and who really take a critical eye and look at the resources that are available within their community and use those to their maximum capacity. So we're looking for how are you using all of the resources in your community. Existing resources, for example, the dollars that are allocated by your county or city government, by your school district, dollars available through businesses and organizations like healthcare organizations, charitable giving in your community through your United Way, through faith-based communities, how all of that collection of resources are used in a way that creates value in your community. So those are financial resources, but what also goes along with this is how are you using human resources? How are you sharing the great intellectual and brain capacity across many organizations in your community. How are you inspiring people to volunteer and maximize the use of volunteerism in your community? So really think about this from a very broad perspective, both about what kind of additional resources you've been able to bring in your community, how you're using the existing resources for a sustainable approach to health, and how you're using not only financial resources but human and natural resources to make the most in terms of creating that lasting change in your community. And for our last criteria, number 6, we'll come back to Abby.
Sure. And in price criteria 6, you can see that here we are looking at how communities are measuring and sharing progress and results. And I just love this photograph because I imagine this little boy, who I think was in one of the Cambridge schools, measuring and tracking how many pull-ups he's able to do each time he goes to gym class. And that is very much the spirit that we lay out in criteria number 6. And what we are looking for here is, how communities are, one, identifying, what success looks like, how they are agreeing on what those outcomes that they are moving towards are, how they continue to track that information, and how they share it. A lot of times, we'll see great examples of how communities are tracking progress, but what really differentiates prize-winning communities is not just how they're tracking, but how they're sharing it with the community and how they're using that as a sort of an opportunity for engagement, an opportunity to both communicate and engage with partners, but also to celebrate progress and to make changes and course corrections along the way. So again, prize criteria 6 is really looking for how communities are measuring, sharing both progress and results.
So I hope at the conclusion of looking at those 6 criteria, you are sitting in your chair or standing in front of your desk and your computer screen saying, this is us, this is our community. Because what we know from prize-winning communities is it takes someone like you listening to this webinar, reading this call for application, to see the jewels and the great success and advances you've made in your own community and say, we're ready, let's move forward and apply. So let's move into what you need to do to apply. So as I mentioned earlier, this screen shows you what I described earlier, how if you go to the County Health Rankings and Roadmaps website, you can click on that Roadmaps tab there, and then the RWJF Culture of Health Prize, or simply type this URL, www.countyhealthrankings.org/roadmaps/prize, and that will get you to the portion of our website that will provide you with all of the background information you need about applying for the prize, including where you can download that call for applications and a link to my RWJF.org portal, which is where you will actually begin to start your prize application. This is the system that the Robert Wood Johnson Foundation uses for all of their applications into their system. So it looks a little bit more like a system you might use if you were applying for a grant. Just don't think about that because you're applying for the prize, as Abby said before, and you'll notice there are some distinct differences. If you have never been to myrwjf.org, you will need to register. It's a very simple registration. Just click on that button. The system will collect some basic demographic information from you, and you will be ready to roll. If you have ever applied for a project at the Robert Wood Johnson Foundation, you probably already have a login. So just enter your email address and the password, and you'll see if you're like me and don't remember what your password is for every site you log in on, you can just click on that forgot your password, and the system will help you reset it. So again, as we talked about at the top of the broadcast, 3 phases. Phase 1 is the phase that is open now to all U.S. communities, and just want to emphasize a question that came in that does include the U.S. territories. So Guam, you are welcome to apply. Puerto Rico, the U.S. Virgin Islands, other territories, absolutely. That is the phase we're in right now, and we'll talk through what would happen in phase 2 and the site visit phase briefly after we have a chance to dig into phase 1. So here's what we will ask you in phase 1. After you've entered some basic demographic information about your community and also about your key contacts, which can be, we'll ask you for 2 contacts from your community. They do not have to be from the same organization. They can be from different organizations, but your key contacts will be the people that we will communicate about the status of your prize application. So you want to be sure they're people who actually check their email, who will be good communicators with the rest of your community members that are part of the prize application. And it really doesn't matter what organization they are from in your community. So the key element of the phase 1 application, other than that demographic information, is the prize essay. And there are 2 parts to the prize essay. The first part is the introduction to your community. The whole essay is 5 pages long, single-spaced pages, and so we suggest that you spend the first page of those 5 pages telling us about your community. So a little bit about the key physical, social, and economic characteristics. It's really helpful. I mean, a little bit about where you are, the rural or urban nature of your community, the population size, a little bit of description of that population, but then really make your community stand out. Tell us what's unique. Are there important historical or cultural events or considerations that help us understand your community? What are some of your great assets in your community, and what are some of your pressing needs? And then tell us a little bit about what has really catalyzed your collective action around health. Was there a special event that did it? Did this happen out of some kind of community-oriented process? Really, tell us how you got started. Then, the second component of the phase 1 essay is that your community will identify 4 accomplishments that you have achieved in your community. So these are specific policies, programs, or strategies that really best reflect your community's response to the identified needs and progress towards better health. It is also 4 accomplishments that you can describe that really illustrate for us, across those 4 accomplishments, the 6 criteria that Abby and I described earlier. So think about 4 accomplishments that show us that you understand that broad view of health, that you're working on a sustainable long-term approach, particularly that focuses on policy or systems and environmental change, that is looking out for health for all and assuring health for everyone in your community, that is working across sectors and using resources wisely, and that you're using data to measure success and measure progress towards success, and how you're sharing that with others. So those people often will say to me, how do I pick which accomplishments? And I say, go back to the criteria and think in your community which of the 4 accomplishments, because I'm sure many of your communities have well more than 4, best reflect those 6 criteria. Now, your accomplishments can be either relatively new or well-established policies or programs. And so if they're relatively new, we really want to know where you're heading in the future. If they're well-established, we really want to know what kind of progress you've made over time with that policy or program, but you're not restricted to a certain time frame as you think about those accomplishments. And they can be either very individual, separate, and distinct, or they can be a closely related collection of policies, programs, or strategies. Let me give you an example there. So many communities have had very active coalitions working on, for example, tobacco use or healthy eating. And so if you have a coalition that's done work in a key area and they have had several different policies, programs, or strategies that they're working on collectively to address a particular issue, that could be one accomplishment, the collective work around attention to a particular need or priority in your community. Here's what we don't want you to include as accomplishments, and that is planning or convening processes, such as bringing together Healthy Jackson County Coalition, or conducting a public health department's community health assessment and improvement planning process, or a hospital's community health needs assessment as part of their response to the community benefit requirements in the Affordable Care Act. Now let me emphasize, it is not because we don't think those planning and convening processes are important. They are clearly important in order to advance health in your community. But we really see those processes as foundational to achieving what you will with accomplishments that are implemented. So we see them as core foundational pieces of doing this work, and therefore not as unique accomplishments that we want you to feature in this application. So once more, I understand that pulling a vibrant multi-sector coalition together is an accomplishment. And I certainly understand that doing a comprehensive community health assessment and an improvement plan are accomplishments. But they are the process you get to accomplishments that will actually affect people's health. And so they're foundational and should not be featured as one of your 4 accomplishments in your prize application. So your phase 1 includes some basic demographic data, the essay, which is 5 pages long, the description of your community, and then the description of 4 accomplishments. And then we have a worksheet that we'll ask you to include. It's basically like an executive summary, but we put it in worksheet format. You'll provide the name of each of your accomplishments, a very brief description. You'll underline which of the primary health factor area or areas you think this accomplishment lies within, and then tell us approximately when that accomplishment started. And that just provides us with, once again, an executive summary of your phase 1 application. Phase 1 will be evaluated by a number of judges from the County Health Rankings and Roadmaps program, our partners, and our colleagues at the Robert Wood Johnson Foundation. We'll review the applications, and while we will be looking at all 6 of the prize criteria, the ones where we give particular emphasis about who should move from phase 1 to phase 2 are the first 3 criteria that are listed in the call for application. So that is looking at how you're defining health broadly, how you've committed to sustainable systems change and policy-oriented long-term solutions, and how you are cultivating that shared and deeply held belief in the importance of equal opportunity for health for all. As we move into phase 2, again, about 50 applications will be advanced to phase 2 in the prize process. And as you recall, that invitation will happen in mid-October, about a month after the phase 1 applications are submitted. And so phase 2 is a second essay, again fairly brief. It will be about 5 pages, and there will be some specific questions that are different than what are your 4 accomplishments that will help us understand more fully how you are moving towards health, how you are activating all of the 6 criteria. In addition to that brief essay, in phase 2 you'll be asked to put a brief multimedia presentation together that will provide an opportunity for you to show us your community, to bring it to life through pictures and voices in your community. Now, I know some of you might be looking at that saying, oh my gosh, how are we going to put together a video or a multimedia presentation? I can assure you, and if you look in the frequently asked questions, we direct you to some really easy to use, very low-cost software that will help you with this, and this is not a big production event. We are not expecting you to go get a video crew or contact your local news agency and spend a lot of money putting this video together. Now certainly if you can enroll volunteers in your community to do that kind of video work and contribute that as an in-kind contribution, how exciting. Or contact a local high school or local technical college and enroll students in helping you do this kind of work. But it's really meant to be a simple way for you to show us and give voice to your application, so it's not as static as just lots of words on a page. So brief, it's 4 minutes or less, multimedia presentation, and you will just post it on YouTube and or any kind of sharing site and give us the link to that. And then finally, phase 2 involves a draft site visit itinerary. So if you're selected to move on to finalist status, you will have a site visit from 4 to 6 judges, and I'll talk a little bit more about that in a moment. So we would like to know, who would you have us talk to? What would you show us in your community? What would that site visit look like? And we'll give you some parameters around that, around how long and what kind of activities we would expect, and you can start to give us insight into what we would do and see if we came to your community. So, as I mentioned, up to 16 communities will move into the site visit phase, and they become finalists. The 16 communities that move into the site visit phase are public finalists, so we will announce to the whole nation who the 16 of you will be. And you will see that we'll have a team of site visitors come to your community, and they'll spend about a day there. The site visits usually run from about noon one day till noon the next, and the activities that generally occur during the site visit include a community tour, a dinner with leaders from your community, and then a community conversation where you can invite a broader group of members of your community to come converse with the site visitors and share with them how you are collectively moving together to create a culture of health in your community. Site visitors will represent the County Health Rankings and Roadmaps program here at the University of Wisconsin, our colleagues from the Robert Wood Johnson Foundation, and national reviewers who are experts in the health of communities who will join us to provide a very well-rounded team to visit your community. So as I mentioned earlier, in phase 1, we'll need you to identify a primary and alternate contact with their organizational affiliation and information. And so again, that can be people from 2 different organizations, from the same organizations, but they will be the people who will receive all of the email communication about the status of your prize application. If you are invited to move on to phase 2, we will then also need you to look at those primary and alternate contacts and make sure you want to keep them the same as you move throughout the process. We know sometimes people's jobs change, or there are changes in circumstances, so we'll ask you to confirm that. And at phase 2, we will also ask you who will accept the prize, who will actually receive the check should you become a winner. Now this must be either a governmental entity or a tax-exempt public charity. So while anyone can be the primary and alternate contact from any organization, in order for the Robert Wood Johnson Foundation to distribute funds to your community, they must give them to either a governmental or a tax-exempt organization. And then finally in phase 2, we'll also share some information about how the foundation and our partners will use submission content going into the future. So often people will say to me, can anyone win? We're a really small place, can we win? We're a really rural place, can we win? We're a huge city, can we win? And the answer to that is yes. We know that all communities, big, small, middle, medium size, places that are ranking the healthiest in their state and the county health rankings and places that are ranking the unhealthiest can all be on a journey towards health. So we are looking for unique approaches. We are, as Abby and I have shared, we're looking to learn from you, and we're not looking to replicate exactly what we found in the previous 12 winners. So unique approaches that represent the 6 criteria. So again, if you feel like all I've said and all Abby said throughout the whole webinar is 6 prize criteria, 6 prize criteria, that's because that is really what drives our evaluation of your applications and ultimately who becomes the 2015 prize-winning communities is really the quality and breadth and depth of your accomplishments, your work together, and how it truly represents an integrated approach to those prize criteria. So we've given you a lot of information. I know that there's a lot of questions out there, and so just give me a moment as I move to looking at the questions and seeing which questions are still left unanswered for the group. And so hold on just a second while I do that. While I'm doing this, I do want to let you know that there are other opportunities for you to learn more about the RWJF Culture of Health Prize. Next Tuesday, July 29th, we'll be holding one of our regular County Health Rankings and Roadmaps webinars on our Take Action cycle. It will be really focusing on how you can be successful in convening sectors, multiple sectors in this working collectively together. So clearly a focus on something that's important to advancing health and one of our prize criteria. And we will be featuring David Weed, who is the leader of much of the effort in Fall River, Massachusetts, so one of our past prize winners. So we encourage you to go to the County Health Rankings and Roadmaps webinar site and take a look at that webinar and register for that as well. And then in August, a date we're still solidifying, but mid-August, we will be hosting a Google Hangout where we will feature prize-winning communities that will also talk to you about their journey of health, and you can learn more about 3 communities. We'll be featuring Spokane County, Cambridge, Massachusetts, Spokane County, Washington, Cambridge, Massachusetts, and a 3rd community we're still waiting to confirm. Again, an opportunity to hear a lot from past winners. So that date will be in mid-August, and stay tuned. We'll make sure that all of those who have been on this webinar to date get notification when that Google Hangout is scheduled. So let's go to your questions. So how many communities have applied for Phase 1 in the past? In the first year, in 2013, we had 163 communities, and last year for the 2014 prize we had 263. So we know there's a lot of interest. Abby, a question I'll pose to you. Can the group initiating the application be religion-based, even though community effort? So can the application be led by a faith-based organization?
Sure. Sure, Julie. So the application can be led certainly by a faith-based organization. We've seen the coalitions that have gone on to win the prize be reflective of many different sectors, including government agencies, nonprofits, coalitions that are sort of representative of many various partners across the community. So there is no limitation there. I think that the place where we get into eligibility and real specificity in terms of that is who the prize dollars can actually go to. But in this case, again, a faith-based organization would certainly be eligible and well-positioned to serve as the primary applicant.
All right, great. Another question, is there a period of time the prize application should be based on? I'll begin that and see if Abby has anything to add. There's no specific period of time. I would say this: if you've just begun your work in this area, within the last year or two, and you've primarily been focusing on bringing a coalition together, doing a planning process, but yet have not yet implemented strategies and therefore have accomplishments to show, it might be early for you. And one of the things we've had people ask us in the past is, will the prize be here in the future? And the answer to that is yes. Abby may want to share a little bit more about the Foundation's vision for the future, but we believe it will be here into the future, and so if you're new in your work, you may want to accomplish a bit more before you apply for the prize. But Abby, any thoughts about the future of the prize?
Well, I would say that it was, just this year that we laid out our vision for a culture of health, and we see the prize as being a very integral part of that vision that we will be implementing in the years to come. So we fully expect that the prize will be around for, at very least, the next 4 years. But like I said, certainly into the foreseeable future, as it aligns very closely with the Foundation's vision and mission to build a culture of health.
Great. And Abby, if we come from a state that has had several winners already, does that reduce our chance of winning?
It doesn't. We really assess each community against those 6 criteria that you've heard us talk about quite extensively. And you can see actually in both years that we have awarded the prize, we've had multiple prize winners from a state. So I think that really, speaks to the nature that our reviewers, our selection committee, and our national advisory group, they are looking for those communities that best exemplify those 6 criteria.
Thanks, Abby. So let's see, here's another question. If we have instituted a broad new policy that will eventually trickle down to create several important positive health impacts over the next 10 years, is that a valid accomplishment, or is it too far from actual immediate health impacts? I'll again start on that, and Abby, feel free to add to my response, but we know that this kind of work can take years to see fruition. So if you have instituted a new policy and it has not been in place yet, that you might see the long-term outcomes of that policy, I would say that is a viable accomplishment for you. We know policy work, first of all, is hard, and that it often takes a long time to get a policy implemented, and that once a policy is implemented, it's also very important to monitor its implementation, being sure it's being implemented with fidelity and in the way you intended it to happen and with good enforcement of that policy. So we know this is a continuum. So clearly, I would say if you are at a point where you've implemented that policy, it is definitely in the accomplishment category. Anything further you'd have to add to that, Abby?
No, Julie, I think you hit the nail on the head.
All right. Let's see. Do we have access to see previous prize winners' criteria? Well, let me tell you, they've had the same criteria, similar criteria in both of the first years of the prize program as we have this year. We continue to refine them and attempt to be more clear about what we mean by each of the criteria, but those 6 criteria are what have guided the applications of the 2013 and the 2014 prize winners as well. I suspect the questioner might have been wondering if you can see the applications of the previous prize winners, and the answer to that is no. You cannot see their actual application for the prize. But I encourage you to visit the gallery on the Robert Wood Johnson Foundation website that gives you extensive background about the 12 prize winners, both from 2013 and 2014. There are stories about them, there are videos about them, and so that it's a really great way to understand the breadth and depth of work that has happened across those 12 prize winners to date. And then again, just to reemphasize the point we made towards the end of the webinar, we're not looking for clones of those 12 prize winners. I think you'll see pretty quickly if you study all 12 of them that they're not clones of each other. They're all very separate and distinct and unique in the way they have approached this. So I understand it's helpful to learn and soak in what others have done, but again, we encourage you to tell your own story as well. So, it looks like we have another question about a particular prize opportunity. When using the formulation of a comprehensive plan, would using the formulation of a comprehensive plan be a good starting point for why we initiated our accomplishments? Yeah, I think that, again, the formulation of a comprehensive plan, especially one that included health, that was part of what assisted you in thinking through where you put your action and your strategy work, is an excellent initiating point. We would just say the plan itself is not really what we're looking for in terms of an accomplishment. Abby, let me throw this question your way. What are the criteria for distribution of the prize monies, or is that up to the prize winners?
Yeah, so I would, go back to the point we made earlier that the prize is in fact a prize, and it's not a grant. So we are not asking for or assessing communities based on a proposed budget or how those dollars will be spent in the community.
Great. And a couple of people are asking about reapplication. If they applied last year, they made it to phase 2, but were not a finalist, is there value in applying again this year? And so, Abby, what do you think about that? Should people who applied last year apply again this year?
So we are very open to having communities reapply. The only place where we have any guidelines about reapplication is for both our prize winners who are not eligible to apply, for our prize finalists, where we do ask them to, sit out a round in order for them to, before they reapply. So that would be sort of skipping a year, waiting a year. But for those that did apply and were not finalists, we really welcome you to reapply. I think we really would encourage you to take a look, at the criteria and very specifically to take a look at the roadmaps to Health Action Center and some of the tools there. And I would specifically call out the Poised for Progress tool, which aligns the criteria of the prize with the various steps and activities and attributes of communities that are doing this work, and just spend some time really reflecting on the work your community is doing, how it aligns with the prize criteria, and where, really where you see your community based on those criteria, where you have seen progress and change over the past couple of years. So I think that's probably a step that is worth your time as you think about reapplying. But we really would encourage you to. I think we would recognize, including our prize winners, that those of us that are doing this work around community health improvement, it is about improvement. It's about continuous improvement, and we're always thinking about, how do we do this better? How do we do it differently? How do we continue to make change? And so we know that certainly is the case with many of the communities that have applied. And again, for that reason, do encourage you to to reapply and really, again, taking it as an opportunity to reflect on how your community work is evolving.
I think Abby's reference to the Poised for Progress tool is a great notation for all of our listeners, whether you've applied in the past or not, as it really provides an opportunity to tell folks your story and to assess yourself with your community partners where you are really doing well towards advancing towards health and where there's opportunity for improvement. So that's really great counsel. We've had another person ask if they're reapplying, should they feature the same accomplishments that they did in the prior application, or should they look to other things? There's really no one way to answer that question for you. Again, I would refer you back to the criteria and really do your own self-assessment of how you think your, oh, excuse me, I thought I had Outlook closed, and clearly I do not. So, but clearly look at those 4 accomplishments across the 6 criteria. If there's a particular accomplishment and you've learned a lot more, you've retooled it, you have more results and more progress that you can articulate about that, that certainly would support continuing to feature that accomplishment. So particularly for those of you who have applied in the past and made it to phase 2, Abby and I can tell you how very, very competitive the process was. And so, those who made it to phase 2, you were on the track. So, look at your application and retool it as you see fit based on the criteria is the best advice that we can give you. I know a lot of people have asked about the PowerPoint and the slides, and I understand that perhaps the slides that were posted on the website cut off and don't include all 38 slides that were presented today. So what I will assure all of you is that we'll recreate that PDF and make sure we have all of the slides in the PDF and repost it for you. So the slides will be available to you in full fashion shortly after this webinar. The other piece that I want to make sure everybody knows is this webinar is being recorded, and we will be posting a recording of the webinar within the week. So if you want to re-listen, if you have other community partners that you'd want to direct to this webinar, it will be available at both the County Health Rankings and Roadmaps website on the RWJF Culture of Health Prize page, and it'll also be available at myrwjf.org. So let's keep looking here, and we will see if there are other question here. Can the lead organization for the application be the award recipient if it is a 501c3? And the answer to that is yes. and that is often the case, but not always the case. So yes, the lead organization where the primary and alternate applicant may be located can also be the award recipient. What I emphasize for you is that's a community decision to make, and so while we don't put any criteria on what the budget is for the award or how you use it, other than it must go to a governmental or nonprofit charitable organization, we encourage you to make that a community decision. Looks like some people have some questions about an accomplishment. Abby, perhaps you can help and start in on this. Can you help us understand how you are defining an accomplishment for the 4 accomplishments required for the Phase 1 essay? And someone else asked, how specific should our accomplishments be? Can we say improving diabetes care as an accomplishment, and then go into greater detail of what we're doing in the essay? So Abby, you want to take a first crack at how we define accomplishment?
Sure. And I think, what you'll find is that we have a pretty broad definition of accomplishment, but we really have seen, kind of 2 flavors of this. One, which is a very specific accomplishment. So this might be a very specific program or policy. Perhaps, maybe it's a universal pre-K that the community has implemented. And likely there were a number of actions and steps that got to that big policy change when, but in some cases it's a very specific accomplishment that the community can point to and talk about how accomplishing that really exemplifies the various criteria. So that's one flavor. I'd say the other flavor would be more of a related set, a related collection of policies, programs, and strategies that are getting at a single outcome. So Julie used the example of improving diabetes care or improving diabetes outcomes. That might, again, involve a whole suite of strategies, everything from individual patient management to changes in primary care, to changes in the physical environment, creating opportunities for physical activity and what have you. So I think it needs to be meaningful to you and your community, because when we would ask you then to talk about that accomplishment, we really want to make sure that you can talk about that in a way that is going to resonate with your community. But from our end, I would say it's a pretty wide definition there, but primarily coming in one of those two distinctions in terms of how communities are talking about and sharing those accomplishments. Julie, feel free to add or edit that in any way.
No, I think that's really helpful, and it's a little difficult for us to be too specific because, as Abby has described and as I described earlier, there can be a fairly wide breadth and depth of accomplishments. So in the past it's been something as focused as, for example, a community that initiated a social host ordinance in their community, to an accomplishment could be as broad as we're addressing childhood obesity in our community, and here is a suite of 6 different strategies we're using, everything from implementing universal breakfast in the schools to implementing SNAP benefits at the farmers market to a wide variety of healthy eating initiatives in the community. I happen to use 2 examples from health behaviors there, so I would again point you to, it could be, as Abby said, establishing universal kindergarten or pre-K in your community. It could be a suite of services or policies and programs to improve graduation rates, ways you're addressing the criminal justice system. One of our prize winners had a set of accomplishments around alternatives to incarceration for low-level offenders in their community and how they had achieved that. So again, it's a little hard for us to be completely specific because there's a pretty wide berth, but what I really want to emphasize for you is it is policies, programs, systems changes that are implemented and in action in your community, not just plans for such things, but clearly in action. Okay, another question. Abby, our organization operates in several communities. Is our home office required to be physically located in the community that we want to have considered for the prize?
Well, I think it depends on sort of what role you're going to be playing. If you are going to be serving as the primary, applicant in terms of being the contact, in essence being sort of a convener, developing the actual materials, that's really up to you and the community to decide if that makes the most sense. What we will say is that when we think about the prize recipient, we do ask that the organization that does receive the prize be located within the community that wins the prize. So that is, sort of one little nuance that I would put there. But if you are proposing that you're going to serve as the applicant in terms of the applicant contact, then that very well might make sense for your community. The one note, and again, not knowing sort of the dynamics or the relationship of how this works, I think applications where we see either a consultant or sort of an outside external organization kind of taking the lead, sometimes those raise some flags with the reviewers. I think that there is very much a desire to want to see the work and the solutions be really locally grown, locally owned, and really sensitive to anything that seems like it's being imposed on a community. So again, not knowing your situation, I would just sort of make both that observation and share that nuance on sort of the specifications in terms of who the actual prize dollars can go to.
Great. Thank you, Abby. So we are approaching the end of our time together. We want to thank our many partners at the Robert Wood Johnson Foundation, our team here at the University of Wisconsin, and partners and partner organizations across the nation without which this work would not happen. And as we come to the end, I want to direct you to some key web places that we've mentioned throughout the webinar. For general information, the County Health Rankings and Roadmaps website, where you'll also find the frequently asked questions, or FAQs, to the Robert Wood Johnson Foundation.org, rwjf.org. And this is on their homepage. You'll see the RWJF Culture of Health Prize winners, and you can just click on that, so don't worry about remembering that very long address. So rwjf.org, and you can learn more about the past prize winners. And then contact information for our colleague Kirsten Siemering, the manager of the RWJF Culture of Health Prize. We had one final question asking about how you might be able to get in contact with prize winners if you'd want them to come speak or share their story in your community. Kirsten would be a great contact for that. You can reach her at prize@match.wisc.edu. And if you ever can't find that email or don't remember it, you can always send email through the Contact Us portion on the County Health Rankings and Roadmaps website. I assure you that's an email box that's monitored on a daily basis, so if you ever have a question about the prize or anything related to Rankings and Roadmaps, don't hesitate to just go to the website, send us an email through there, and we'll be happy to answer those questions. So again, we are very happy you joined us this afternoon. We look forward to many of you submitting applications. For those of you who asked questions today, any of the questions that are not already addressed in our FAQs will be available on our website by the end of the week, as will the recording of today's webinar. So we wish you a happy and healthy rest of your week, and thank you again for joining us today.